Hello, I'm Beth Kelsey, the Editor-in-Chief of Women's Healthcare Clinical Journal for NPs and the official journal of the National Association of Nurse Practitioners in Women's Health. Post-traumatic stress disorder, or PTSD, affects about 6% of U.S. adults overall at some point in their lives. Women, however, have a higher lifetime PTSD prevalence rate of 9.7%, compared to 3.6% in men. PTSD involves a group of symptoms experienced after exposure to a traumatic event that may include re-experiencing the event, avoiding situations that trigger memories of the event, experiencing increased negative feelings and beliefs, and/or experiencing feelings of hyperarousal such as irritability or anger. People affected by PTSD have high rates of psychiatric comorbidity and often have problems functioning within the workplace, school, and in family and social relationships. Treatment guidelines are available, but the fact is that almost 1/2 of adults with PTSD don't get mental health services, and among those who do, 40% get minimally adequate treatment. Although studies have shown that about 92% of adults with PTSD eventually achieve remission, the median time to that remission is 14 years. The Patient-Centered Outcomes Research Institute, or PCORI, supported a systematic review that looked at the comparative effectiveness of different psychological and pharmacological treatments for adults diagnosed with PTSD. Based on these findings, PCORI published 2 documents, one for healthcare providers and one for consumers, summarizing the evidence on the effectiveness of PTSD treatments. Links to both PCORI documents are provided here. Within the documents, you'll find a link to the article on the systematic review results, as well as links to PTSD clinical practice guidelines from the American Psychological Association and the U.S. Department of Veterans Affairs. The journal and NPWH have several related resources that you may also find valuable. Links to relevant articles and position statements are below. Thank you all for the work you do.